I think of caretakers, hardworking professionals because of all the licensing and testing that they go through. Um, and I just think overall that nursing is, or when I think of nurses, I think of like individuals and humanity because they are people who take care of other people. And yeah, that's what I think.
They're really helpful for our lives.
Okay, so when I was 3, my brother and I were digging to China in the backyard, and he hit me in the head with a shovel. And so one of my first memories of like being cared for because of an injury is my mom taking me to the doctor to see if I needed stitches on my forehead, and trying to clean the dirt out of my face. But people were really, I mean, I was like 3 at the time, and people were just really caring and gentle, and definitely grateful for that.
Sweet. Well, every time I went to the ER with like broken bones, all the nurses were there. But specifically when I had knee surgery, I had a really nice nurse that like helped me calm down and actually like got me through it. So shout out to nurses.
I think about sort of how the ethics component tends to be understated and how there's like a real lack of information about gender nonconforming and intersex people, and how as a result there's a lot of mishandling of that in the field of nursing.
Okay, when I think of a nurse, I think of someone who is caring and also patient, because I know that those are 2 qualities you have to have in order to, deal with all kinds of people, whether they're sick or just their relatives who are kind of impatient. Yeah.
When I think of a nurse, I think of someone that's like, they have to multitask a lot because they have to take care of a lot of different people. I think they have to do like a lot of paperwork, and they have to be kind of nice people because they have to deal with the patients the most, I think. Like give medicine, take shots and stuff like that. So that's what I think of.
When I think of nursing, I think of all the different types of nursing, from trauma nurses all the way to pediatric nurses, but in the end, they all have one purpose, and it is to care for their patients and the people they interact with every day.
Someone who helps others in terms of like medical, but like also emotional, like the first people you see when you go into the doctor's office. They're really great people.
When I think of nurses, I usually think of just like the kind, loving people who are always there to welcome you when you first go to your appointment. I feel like I end up having more of a relationship with the nurses because they always ask how I'm doing and just are so like nice and friendly when I meet them. So I love the nurses that I've encountered so far.
When I think of nurses, I think of the warm and welcoming individuals who help me out when I get to the doctor's office. They make sure that I feel settled and safe and comfortable. And they always make my nervousness go away, and then they also make sure that all the hard work gets done and that I get all my meds and documentation that I need.
When I think of nurses, I definitely have that stereotype of women, which I mean, I guess for me is like a kind of good thing because I feel like women in general are more healing for me personally. But yeah, I think of people who are just there, who are a little easier to talk to rather than doctors, people who are there to like help care for you instead of just like treat you.
In my personal philosophy of nursing, I talk about being your authentic self and letting your true self be seen. And as a result of authenticity, you need to be vulnerable with someone, and you need to show up, or when your patient's having a bad day or a good day, you need to be there and care for them holistically. I also really talked about my pursuit of truth, that I want to love with my whole heart, whether that be a person or as a nurse. Just, I want how I am as a person and a nurse to align.
Nursing is dedicating yourself to helping others and providing people with an environment, so like a healthy environment for them to heal, and it's it's dedicating yourself to help people regardless of their background. So getting rid of your own biases and prejudice to help others, and it's also like making personal connections with people and like including the patient in with their care and asking them what their values are and how they would like to be taken care of.
Okay, so I think nursing is a lifestyle, honestly. You have to be caring, compassionate, and we will be representatives of a very diverse population, and we constantly have to educate ourselves on who we treat and be mindful of their values and their beliefs, and try not to assume things and educate ourselves. And we are people who want to be in areas where people don't want to be, so we can help those that are in need. And okay.